Today, the greatest risk of global catastrophe doesn't look like this. Instead, it looks like this. Now, part of the reason for this is that we have invested a huge amount in nuclear deterrence, but we've actually invested very little in a system to stop an epidemic. We're not ready for the next epidemic.
Agony in Europe tonight as Italy's death toll passes 10,000.
I've got to be clear, we've all got to be clear, this is the worst public health crisis for a generation. More families, many more families, are going to lose loved ones before their time.
Nous sommes en guerre. En guerre sanitaire, certes. Nous ne luttons ni contre une armée, ni contre une autre nation. Mais l'ennemi est là, invisible, insaisissable, qui progresse. Et cela requiert notre mobilisation générale.
The numbers of death, people that have died, it's so horrible. We had a number of 100,000 lives, as many as that is, it's impossible to even think of it.
As of April 12, 2020, more than 1.77 million cases of COVID-19 have been reported in 210 countries and territories, resulting in more than 108,000 deaths. More than 402,000 people have recovered, although there may be a possibility of reinfection. Coronavirus disease 2019 or COVID-19 is an infectious disease caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. The disease was first identified in December 2019 in Wuhan, the capital of China's Hubei province, and has since spread globally, resulting in the ongoing 2019-20 coronavirus pandemic. Common symptoms include fever, cough, and shortness of breath. Other symptoms may include fatigue, muscle pain, diarrhea, sore throat, loss of smell, and abdominal pain. The time from exposure to onset of symptoms is typically around 5 days, but may range from 2 to 14 days. The virus is mainly spread between people during close contact, often via small droplets produced during coughing, sneezing, or talking. While these droplets are produced when breathing out, they usually fall to the ground or surfaces rather than being infectious over large distances. People may also become infected by touching a contaminated surface and then their face. Coronavirus lasts on surfaces around 72 hours. The standard method of diagnosis is by real-time reverse transcription polymerase chain reaction, the RT-PCR, from a nasopharyngeal swab. Chest CT imaging may also be helpful for diagnosis in individuals where there is a high suspicion of infection based on symptoms and risk factors, but not recommended for routine screening. Recommended measures to prevent infection include frequent hand washing, maintaining physical distance from others, especially from those with symptoms, covering coughs and sneezes with a tissue or inner elbow and keeping unwashed hand away from the face. The use of masks is recommended for those who suspect they have the virus and their caregivers. Recommendation for masks used by the general public vary, with some authorities recommending against their use, some recommending their use, and others requiring their use. Currently, there is no vaccine or specific antiviral treatment for COVID-19. Management involves treatment of symptoms, supportive care, isolation, and experimental measures. The World Health Organization (WHO) declared the 2019-20 coronavirus outbreak a public health emergency of international concern on January 13, 2020, and the pandemic on March 11, 2020. Myth busting. The first one. 5G mobile networks do not spread COVID-19. Viruses cannot travel on radio waves, mobile networks. COVID-19 is spreading in many countries that do not have 5G mobile networks. Number 2. Exposing yourself to the sun or to temperatures higher than 25 degrees does not prevent the coronavirus disease COVID-19. 3. Catching in the new coronavirus does not mean you will have it for life. Number 4. Being able to hold your breath for 10 seconds or more without coughing or feeling discomfort does not mean you are free from the coronavirus disease, COVID-19. Number 5. Drinking alcohol does not protect you against COVID-19 and can be dangerous. Number 6. COVID-19 virus can be transmitted in areas with hot and humid climates. From the evidence so far, the COVID-19 virus can be transmitted in all areas, including areas with hot and humid weather. Number 7. Cold weather and snow cannot kill the new coronavirus. Number 8. Taking a hot bath does not prevent the new coronavirus disease. Taking a hot bath will not prevent you from catching COVID-19. Your normal body temperature remains around 36.5 to 37 degrees, regardless of the temperature of your bath or shower. Actually, taking a hot bath with extremely hot water can be harmful as it can burn you. Number 9. The new coronavirus cannot be transmitted through mosquito bites. To date, there has been no information, no evidence to suggest that the new coronavirus could be transmitted by mosquitoes. Number 10. Can spraying alcohol or chlorine all over your body kill the new coronavirus? No, spraying alcohol or chlorine all over your body will not kill viruses that have already entered your body. Spraying such substances can be harmful to clothes or mucous membranes. Be aware that both alcohol and chlorine can be useful to disinfect surfaces, but they need to be used under appropriate recommendations. If you have fever, cough, and difficulty breathing, seek medical care early, stay home if you feel unwell, seek medical attention, and call in advance. Follow the directions of your local health authority. Why? Well, national and local authorities will have the most up-to-date information on the situation in your area. Calling in advance will allow your healthcare provider to quickly direct you to the right health facility. This will also protect you and help prevent spread of viruses and other infections.